You may think stroke is something that only happens suddenly and without warning. But the truth is, your body often whispers long before it shouts. Every year, millions of seniors are rushed to the hospital because of a stroke. And many never return to the life they once knew. But here is the frightening part. Most of those strokes could have been prevented if only the warning signs and hidden triggers had been recognized in time. As a doctor who has treated countless elderly patients, I can tell you strokes are not just bad luck. They are the result of silent damage building up over years. Damage that most people dismiss as ordinary aging. Fatigue, dizziness, blurred vision, confusion, weakness in the arms or legs. Too many seniors brush these off, waiting until it is too late. In today's guide, I will reveal 7 silent stroke triggers that every senior must know. These are the causes and risks that quietly build up in your blood vessels and brain, waiting for one wrong moment to change everything. I will explain exactly how they damage your body. Share stories of patients who ignored the warning signs. And most importantly, show you how to fight back with smarter choices. Because yes, strokes are devastating, but they are not inevitable. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. And if you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Let us begin with the most common and deadly trigger of all, one that damages arteries slowly, silently, and relentlessly. Part 1. High blood pressure. The silent destroyer. High blood pressure is the single most dangerous trigger for stroke. And yet, it is often ignored because it causes no pain. In elderly women and men, arteries become stiffer with age. And when pressure inside those vessels rises, it is like water pressing against an old brittle pipe. Eventually, the pipe bursts or clogs, and in the brain that means a stroke. I once treated a 70-year-old woman who insisted her dizziness was just fatigue. Her blood pressure was 180/95. A ticking time bomb. Within a week, she suffered a hemorrhagic stroke. Studies show that uncontrolled high blood pressure accounts for nearly half of all strokes worldwide. The mechanism is simple but deadly. Excess pressure weakens the vessel wall until it ruptures, or it accelerates the buildup of fatty plaques that block blood flow. Symptoms like headaches, blurred vision, or nosebleeds may appear, but often there are none. That is why doctors call hypertension the silent killer. For seniors, the solution is strict control, reducing salt intake, taking prescribed medications, and maintaining daily physical activity can lower risk dramatically. Even a brisk walk for 30 minutes a day helps reduce pressure and improve circulation. If this shocked you, wait until you hear about the next trigger. One that hides in the rhythm of your own heart. Part 2. Atrial fibrillation. The hidden clot maker. Atrial fibrillation is an irregular heartbeat that many seniors dismiss as harmless palpitations. But it can quietly form clots inside the heart. Those clots travel directly to the brain, blocking blood flow and causing devastating ischemic strokes. In fact, people with untreated atrial fibrillation are 5 times more likely to suffer a stroke. I remember a 68-year-old patient who came in after briefly losing vision in one eye. The tests revealed atrial fibrillation and a clot that had nearly traveled to the brain. Fortunately, we caught it in time. The danger with atrial fibrillation is that symptoms can be subtle. You may feel your heart racing, a flutter in the chest, or mild shortness of breath. Sometimes there are no symptoms at all. But inside the atria, Stagnant blood is swirling, waiting to clot. For elderly women, the risk is especially high because hormonal changes and longer lifespans expose them to years of strain on the heart. Diagnosis requires an electrocardiogram or long-term heart monitoring. And treatment often involves blood thinners and medications to control rhythm. The takeaway is simple. If you ever feel irregular beats, do not ignore them. Your heart's rhythm can be the difference between life as you know it and life after a disabling stroke. And if the heart can create clots, the arteries themselves can quietly narrow until they choke off blood to the brain. That is our next hidden danger. Part 3. Carotid artery disease. The narrowing pathway. The carotid arteries run along the sides of your neck, carrying blood directly to your brain. When they become narrowed by fatty plaque, a condition called carotid artery disease, blood flow is reduced and stroke risk skyrockets. Imagine squeezing a garden hose while trying to water your plants. The pressure builds behind the narrowing, and small pieces of plaque can break off, traveling to the brain and lodging in smaller vessels. I treated an elderly woman who had only experienced brief episodes of slurred speech. Her family thought it was stress. A carotid ultrasound revealed her artery was nearly 80% blocked. Surgery saved her. But had she waited another month, she likely would have suffered a massive stroke. Symptoms of carotid narrowing can include transient ischemic attacks, short spells of weakness, vision changes, or confusion. But again, many people feel nothing at all until the blockage becomes severe. The good news is that screening tests like ultrasound are painless and quick. Lifestyle changes such as quitting smoking, lowering cholesterol, and controlling diabetes slow the progression. In severe cases, procedures like stenting or endarterectomy can restore blood flow. Ignoring this condition is like ignoring cracks in the foundation of your house. It only grows worse until one day it collapses. And if blockages are dangerous, so too is the opposite problem. When blood vessels rupture and bleed, that is the hidden nightmare of hemorrhagic stroke. Part 4. Hemorrhagic stroke. When vessels burst, unlike ischemic strokes caused by clots, hemorrhagic strokes occur when a blood vessel inside the brain ruptures, flooding the tissue with blood. This not only deprives brain cells of oxygen, but also compresses them under pressure, causing double damage. The most common cause is uncontrolled high blood pressure. But other triggers include aneurysms, blood vessel malformations, and excessive use of blood thinners. I will never forget a patient in her 70s who arrived with the worst headache of her life. Within minutes, she lost consciousness. A scan showed a ruptured aneurysm. The truth is that many elderly patients live with fragile vessels weakened by years of hypertension or amyloid protein deposits, making them vulnerable to sudden rupture. Symptoms can include sudden, severe headache, nausea, vomiting, dizziness, or loss of consciousness. Unlike ischemic strokes, there is often little warning. That is why controlling blood pressure and avoiding unnecessary use of blood thinners is critical. Treatment may involve surgery to clip or coil an aneurysm, or medications to reduce pressure inside the skull. Recovery is often long and difficult. The best defense is prevention, but sometimes strokes strike in miniature, giving us a brief warning shot. That is the transient ischemic attack. Part 5. Transient ischemic attack. The warning stroke. A transient ischemic attack, or thanks in advance, is often called a mini stroke. But do not be fooled. It is not minor at all. A thanks in advance happens when blood flow to part of the brain is briefly blocked, causing stroke, like symptoms that last only minutes or hours. The danger is that many seniors dismiss it once the symptoms fade. But research shows that up to 1 in 3 people who experience a thanks in advance will go on to have a full stroke within days or weeks. I once cared for a woman who experienced numbness in her arm that disappeared after 10 minutes. She decided not to seek help. 2 days later, she returned to the hospital with a major stroke that left her unable to speak. The signs of a thanks in advance are identical to stroke sudden weakness: face drooping, slurred speech, vision problems, dizziness, or confusion. The key is urgency. Even if symptoms vanish, you must call emergency services immediately. Doctors will investigate with scans, ultrasounds, and blood tests to find the cause and prevent the next event. TIAs are nature's red flag, a final warning that time is running out. Ignoring them is like ignoring the smoke before a fire. And while TIAs warn us, other conditions quietly erode brain vessels over decades. One of the most common being diabetes. Part 6. Diabetes and high cholesterol. The slow erosion. Diabetes and high cholesterol often travel together, silently damaging arteries and nerves year after year. High blood sugar injures the delicate lining of blood vessels, making them prone to plaque buildup and narrowing. High cholesterol accelerates that process, laying down fatty deposits that restrict blood flow. In seniors, this combination is especially lethal because it affects not only the large arteries, but also the tiny vessels deep in the brain, leading to small vessel disease. The result can be multiple mini strokes that accumulate over time, causing memory loss, trouble walking, or mood changes. I remember a 75-year-old woman who complained only of clumsiness and forgetfulness. An MRI showed multiple small strokes caused by long-term diabetes and high cholesterol. The solution is aggressive management, monitoring blood sugar, taking cholesterol-lowering medication, and following a diet rich in vegetables. Fruits and whole grains are essential. Exercise improves insulin sensitivity and raises good cholesterol levels, protecting vessels from further damage. For seniors, this is not just about preventing stroke. It is about preserving independence. Because every vessel protected is another day of clear thinking, walking without fear, and living on your own terms. But beyond sugar and fat, there are lifestyle habits that add fuel to the fire, making strokes even more likely. Part 7. Smoking, alcohol, and inactivity. The lifestyle traps. For many elderly patients, the greatest stroke triggers are not hidden in their blood but in their daily habits. Smoking damages blood vessel walls, increases clot formation, and raises blood pressure. Alcohol in excess raises triglycerides, weakens the heart muscle, and disrupts normal rhythm. Physical inactivity allows weight gain, high blood pressure, and diabetes to worsen unchecked. Together, these habits create a perfect storm for stroke. I once counseled an older woman who had survived a mild stroke. She believed quitting smoking at her age would not matter. 6 months later, she suffered another, more severe event. The truth is, it is never too late. Studies show that quitting smoking even after age 70 reduces stroke risk within months. Limiting alcohol to no more than 1 drink per day for women helps control blood pressure, And incorporating just 30 minutes of light walking 5 days a week can cut stroke risk nearly in half. Seniors often believe lifestyle changes no longer matter, but the science proves otherwise. Every day you choose to care for your body, you are rebuilding protection around your brain and heart. These are choices no pill can replace. And when you add them to medical treatment and regular checkups, you create a shield against one of the most devastating conditions of aging. Doctor's final words. After decades of treating patients, I can tell you this: stroke does not strike without reason. It builds silently, triggered by pressure, rhythm, narrowing, bleeding, or the habits we ignore. But the same way damage builds silently, healing can build too. Your body remembers how to repair when you give it the chance. Controlling blood pressure, managing diabetes, checking cholesterol, quitting smoking, and staying active are not just medical advice. They are acts of love for yourself and those who depend on you. Every time you recognize a warning sign, every time you choose a healthier option, you are rewriting your future. I have seen 80-year-olds recover independence and 90-year-olds regain their clarity simply because they chose not to give up. Your brain is precious. Your life is irreplaceable. And your choices still matter. Please do not ignore the 7 silent triggers of stroke. Share this message with someone you love because awareness saves lives. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, comment 1. If not, comment 0. Do not forget to like, share, and subscribe to our channel for more health tips made just for you. Thank you for watching, and here is to living life on your own terms.